Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. I'm here today with Emily. How are you today, Emily?
Doing great.
Awesome.
It's been a good Monday.
Yes. Happy Monday. It's a gloomy day here in Franklin. And today we are going to do just a little intro podcast for Emily. She's joining our team, as well as kind of diving into our women's health program and what we do here at Fiat. For anybody who hasn't heard, maybe some of our previous podcasts all about women's health, as well as what Emily brings to our team. So super excited about that.
Thanks. I'm excited too.
Tell us, well, first of all, you just got back from Italy. So tell us, what were you doing in Italy? And also recently married. I can't even remember your married name.
Thompson.
Love
Thompson.
So tell us a little bit about your trip.
Yeah. So one main reason we went to Italy was to try to meet the Pope if we could. And we thought, this is probably our greatest chance as newlyweds.
Right.
You have the opportunity to sign up to get a ticket, and he offers a special blessing for newlyweds.
Mm-hmm.
So we did end up joining a big crowd of newlyweds and got to shake our Pope's hand, which was pretty fun.
Cool.
Who knows if we'll ever get to do that again in our life.
Yeah. Don't you have to wear a wedding dress?
I did. It wasn't quite my wedding dress, which they did tell you they want your wedding dress.
Okay.
But it was kind of a backup, something I found on clearance. It was a white dress. It passed the test.
Okay.
They really cared that we were married in the last 3 months. So I think that's been changed recently.
Yeah. I thought it was like a year or something.
I know. I think they're a little more strict now. But
cool.
Yeah, it was a great trip. A friend of my husband's, Reed Robinson, was ordained as well as a deacon. And so it was a really wonderful celebration of that, and really cool to experience that sacrament in St. Peter's Basilica, of all places, right?
Incredible.
So meaningful.
Are you jet lagged?
A little bit, but I found I'm more awake in the mornings and less awake in the afternoon. So we'll see how I am this afternoon, but right now I'm doing well.
That 3:00 coffee might come in handy.
Yes, this afternoon.
So tell us a little bit just about brief, where you grew up, what brought you to Nashville, and then we'll jump into kind of why you pursued a career in medicine and where all that went.
Yeah. I grew up in Boulder, Colorado. So pretty different, I would say, from Nashville.
Mm-hmm.
Different culture. But in some ways, Boulder does appreciate health in a lot of ways.
Right.
So I would say some of those seeds were planted when I was young about appreciating exercise and being active and eating well.
Mm-hmm.
I can thank my parents for that, but also even the culture of Boulder played a part of that. It's funny, my parents aren't in medicine, but all 3 of their kids dabble in medicine in some way.
Mm-hmm.
I think we were just raised with an appreciation for the human body and for the sciences and what we're able to do and learn in the world of medicine.
Clearly, they planted some kind of seed.
I know. And I think I'm still trying to figure out what it was that they said or did. But obviously, it had an effect because, we're all in some way related, working in medicine in some related capacity.
Okay,
so
cool.
Yeah, I think that I wanted to do something meaningful, of course, like most people do.
Sure.
And I also have always enjoyed being with people and working with people.
Mm-hmm.
And so that doesn't necessarily narrow it down to medicine, but there's so many things you can do that help people and work with your hands.
Right.
But yeah, I wanted to do something tangible, something that I could see the results of.
Mm-hmm.
Yeah. And I also didn't want to spend forever in school. I wouldn't say school is my passion. It's more so getting to work with people. So that kind of narrowed it down, took med school off of an option. I was like, I don't really want to go to school for years and years. But I was attracted to the nurse midwife specialty because that allowed me to specialize already and become a provider.
Mm-hmm.
So I really liked that I would be able to become a provider and already kind of specialize in women's healthcare.
Yeah.
I wasn't really attracted to doing everything I could in healthcare, but I liked the idea of doing one thing really well. And even then, there's a lot you can do in women's healthcare, of course. But I like the idea of trying to stay specific and narrowing down my patient population to women, mostly, if you're studying to be a nurse midwife, It's around mostly in your fertile years.
Sure.
So
childbearing age.
Yeah, generally relatively young, relatively healthy. I've always been attracted to that specific population. I found really interesting. Just anything related to fertility, I found really beautiful and interesting. I've just been attracted to that.
That's awesome. So did you start by getting your RN, or did you go through like a bridge program at Vanderbilt?
Yeah, great question. So I started with a bachelor's. I studied the liberal arts in college and took nursing school prerequisites. And so I moved to Nashville in 2020 to start Vanderbilt's nurse midwife program. So the first year in that program, you study to be a nurse. Everyone who enters that program, at least at the time when I entered, we were all planning to enter a specialty of some sort. And so I already knew, okay, that's the specialty I want to enter. So the first year just studying to be an RN, and then the next couple of years was studying to be to get a master's in nursing and to be a nurse midwife.
That's great. And just for people who don't know the difference, because there's lots of kind of different certifications out there and boards and whatnot. So like explain the difference between a certified nurse midwife and say a family nurse practitioner, which is what I do.
Yeah. I like to say that they're kind of like cousins. It's very similar training. In my program, the nurse midwives went to school 1 semester longer than nurse practitioners, but a lot of it overlaps. I think nurse practitioners and nurse midwives, they're very similar to what a doctor can do. I guess I'm more familiar with, as a nurse midwife, I'll tell people related to pregnancy, I can do anything except for super high risk or surgery. Like I don't do C-sections. So it's still a lot of like medication management and a lot that you would think, oh, your typical family doctor can do. Nurse midwife is just more training with specifically postpartum, pregnancy, birth, women's healthcare, even preconception.
Yeah, exactly. Because like I can't deliver a baby, nor do I want to deliver anybody's babies. So that added on, being able to do that. But you also then like can't see kids or males unless they're related to like fertility. So it does narrow down what you're doing and just the different scope. It's a little different.
I just think I'd need more training for that.
Yeah, exactly. And then tell me a little bit about, you, before coming to Fiat, you worked at Hope Clinic. So a little bit about your faith journey, maybe, just because clearly Hope Clinic is a Christian-based clinic. Obviously, we're a Christian-based clinic. So how that has tied into your career path and then also kind of your experience at that clinic.
Yeah, both my job at Hope Clinic and Fiat, both opportunities felt very providential and were not necessarily the jobs I was expecting to receive post-graduation. After I graduated, I did start just looking for normal nurse midwife jobs, maybe your more typical nurse midwife jobs, which would be in a hospital or birth center typically to start. Yeah, I just barely started looking and then found out, or people at Hope Clinic reached out to me about a position that had opened up. And they knew me from volunteering. And I knew that we're on the same team. If I go work as a nurse midwife somewhere else in Nashville, we need to know who we are because we should be working together.
Right.
So Hope Clinic, the heart of Hope Clinic is caring for women who are considering abortion, I would say is the main service of Hope Clinic. They do some other things like counseling and education, and they also do some medical care there for women. I call it just like basic women's health care. But kind of the heart of Hope Clinic is meeting with women who are considering abortion and hoping to help them feel supported so that they don't have to choose an abortion. Sometimes women feel like that's the only option they have.
Right. Even if that's not what they want to do per se.
Yeah. And so Hope Clinic's trying to show these women, hey, there is support, there is help. You don't have to do this. Sure. So I loved that mission.
Oh, yeah.
Yeah. And I thought, again, that's so meaningful. That's so powerful. Who wouldn't want to be a part of that mission? And it felt like a great intersection of my medical skills and training with a mission I was really passionate about. And so I managed their medical team. So I got to see patients on their offering basic women's healthcare, but then just wore a lot of different hats, even meeting with pregnant women and doing those, we call those options appointments, but doing those appointments where we just help women think about their situation and kind of evaluate what support they need and everything. So yeah, at Hope Clinic, it was more We did a lot of STD testing. We did a lot of PAPs, so cervical cancer screening.
Sure.
Yeah, and just a lot of education. So they don't require health insurance. In some ways, kind of like Fiat, they don't need it to be able to provide the services they offer, which is really freeing, I found, to be able to offer care to whoever needs it.
That's beautiful.
Yeah.
Such a beautiful mission. I love what they're doing. And tell me a little bit more about like your faith and how that kind of intertwined with all that.
Yeah. I would say my faith has been a driving factor this whole time, provides motivation for why I do what I do and what I care about. So I think that relates to everything from when a woman is pregnant. Like at Hope Clinic, we're seeing a lot of women who are pregnant who often didn't want to be pregnant. And it also relates to women who are very much desiring to be pregnant and see that as a good and beautiful thing. Yeah. So I love learning about how God has designed our bodies and our souls and our hearts and what we long for. And I think it all relates to healthcare too. I don't think you can really separate one from the other. I just think it's really beautiful to learn more about how, if we do our best to follow the Lord and learn about his design for us, like he wants good things for us in a lot of ways.
That. Yeah, I think something that comes up a lot, or just when I reflect about, what the work that we're doing here at Fiat or just healthcare in general, when it's done well and done right, I'm like really like at its core, I would define it as like respecting the dignity of the human person. Like that's our goal here at Fiat. I know obviously that's like Hope Clinics as well in a different light and a different kind of facet of where we are in our culture. And, I think people are always like, oh my gosh, like love Fiat. Fiat's amazing. All this stuff. I'm like, I don't think we're doing anything crazy above and beyond. Like, I think we are getting back to just the root of like, how do we respect you as a human person and help you get your body to the way that God designed it to be. And it's really, it feels very simple.
I wish it wasn't such a revolutionary idea.
Right.
Yeah.
It is. It's like we've fallen so far, or like the world around us has fallen so far that like what should be standard seems exceptional, in my opinion. Like I think we do give exceptional care. That's our goal, but like really it should be just standard of care. Everyone should be respecting the dignity of every person that walks in their door. So yeah, I just think that's really beautiful how you got that at Hope Clinic too. And we've talked about this, but it's really interesting how you have that experience and perspective. And then I don't want to say it's a 180. It's almost like the other side of the coin when you come here to Fiat.
Yeah.
So tell me a little bit about now that you've come to Fiat, your experience of like how we do women's health here and what attracted you to coming here and all of that.
What attracts me most to working here is what you're talking about, is that Fiat offers an opportunity to provide healthcare that does respect the design of the human body, which unfortunately feels like it's hard to find a job that lets you do that.
Right. Isn't that wild?
Yeah, or even just a healthcare system that even knows about that.
Especially in women's health.
Especially in women's healthcare.
Which is just, again, like kind of mind-boggling. But
yeah. And I think some people just don't know that there are other options out there.
Right.
For one reason or another, it seems like Western medicine has kind of gone down this trail of, in women's healthcare especially, which I know the most about. I don't know as much about Western medicine in other areas, but the options to try and heal issues aren't necessarily healing your body. I've seen a chart before. If you have this fertility issue or this fertility issue, all roads kind of lead to IVF. And if someone has any issues with that, whether it's moral issues with that whole process of IVF, or even if someone takes issue with, wow, what a woman has to go through to make her body ready to receive, this embryo that's been created outside of the womb, there aren't a lot of alternatives. And so IVF is one example, but also just in women's healthcare, anything from painful periods to acne to heavy bleeding. Unfortunately, Western medicine offers a lot of options that suppress ovulation, which has a lot of health side effects. If you're looking at it from even just a purely secular perspective.
And would you say that's what you got in your like education as a whole? Like that was like the training you came out with, right?
Yeah, unfortunately. It's a tragedy that typical higher level education it just feels like they don't know any better. And it just offers that as your option is what I've kind of come to learn more now is like, oh, all of these options kind of hurt the body. And so it takes further reading and education to learn about, oh, there are these other alternatives where you can help heal the body as much as possible from the root problem. And that ultimately is just healthier and provides better outcomes.
Yes. It's like, again, like going back to like, how did God design us? You know, how do we study that as opposed to like, how do I make my symptoms go away? Oh, well, like just put birth control on it and your symptoms are going to go away. Okay. But is that in line with God's design for us? You know, is that actually bringing about healing, which we know it doesn't? And so I would love to hear a little bit about some of the educational things that you've done since graduating and like seeking to treat women in this way and how that's opened your eyes to even like some patient cases, if you want, how things are done differently and how we do them differently here at Fiat.
Thankfully, I think there is a lot of information available to anyone who is interested in this. I think there are ways to learn more about options out there, whether it's through books or podcasts. The book I've been reading recently is called It Starts with the Egg. I forget the author off the top of my head, but you know, I'm learning so much in that book, and that's available to anyone who wants to order it off of Amazon, you know, or wherever. But officially, I did some training recently through FEMM, FEMM, and that was really encouraging to go to meet other healthcare providers who are also wanting to provide this kind of healthcare. Yeah, and I think ways that I've seen this alternative treatment work, sometimes I'll read inpatient charts, you know, or collect a history, and a patient's been offered other ways to maybe help her having heavy bleeding or something like that through maybe an IUD or progesterone. And while hormonal supplementation it's not always a bad thing, right? We definitely supplement with hormones here.
Yes.
But we do it in ways that it feels a little more specific. So maybe you're just taking progesterone in the second half of your cycle in your luteal phase to support the progesterone your body's already producing in that cycle or in your cycle instead of every day of the cycle. And it feels more fine-tuned, I think. And the kind of medicine we would provide here too would be a little more in-depth to ask the question of, okay, well, why is someone bleeding heavily? Let's maybe get an ultrasound. Maybe let's take an in-depth history on your cycle to learn, okay, what kind of bleeding and when are you bleeding? And okay, is that a sign of an infection or is that a sign of something else that we can help you feel better and heal and really solve the problem instead of maybe masking it or never really getting to the root problem to figure out how we can help someone get better. Yeah.
And I think too, we do a lot of some in-depth lab work, hormone related, cycle day specific, days, 3, what I comment, I hear this through the grapevine, day 3, 4, or 5,
Yes. And then again in the luteal phase, like 19 through 21.
Yeah, exactly.
And so it does feel more fine-tuned. Yeah.
And I know I've seen patients who are like, my OB or my GYN, they drew hormones for me, but they told me like, basically it didn't matter.
Yeah.
Which is like, what do you mean it doesn't matter? And going back to, I think a lot of people get frustrated with women's healthcare and they want to like throw it back on the provider, which I understand. Like you go to someone and you're like, you won't even like test my hormones and you're a GYN, or, you do, and you say it's normal, but it's not nice. And you put me on birth control, whatever it is. And I think it just goes back to like the system that they are in is just broken, and the training is broken. And you really have to want this kind of education and this kind to provide care in this way. And you have to very intentionally seek it out. So I hate that it goes back on the provider. So I'm like, they just were put in this awful system and taught the wrong things. But we're trying to fix that, obviously, here and do it the right way.
Yeah. And I found that patients too are discovering this, that sometimes patients have gone through other routes to try and find healing or healthcare or to get pregnant, and sometimes do become frustrated with those other routes. And I think that's sometimes how they find Fiat is, oh, wait, there's another way of doing things that works with my body instead of hurting my body or kind of working against it.
Right. Or like band-aiding it, or let's just throw something at it, but we're not really sure why we're throwing it at it, as opposed to like, no, you have insulin resistance and this is how we treat it.
Yeah.
Or like, yeah, you have low ovarian reserve. Like we have some tangible answers that we're treating. Maybe what's one example of like just a tangible patient maybe that you've seen? I know you've been doing a lot of shadowing with Amanda and seeing some patients here at Fiat that like, this would have been done completely different if I was in just a normal OBGYN office or something like that.
Yeah, there's a lot that comes to mind.
Yeah.
One specific thing that comes to mind is lab values and how typically even like thyroid values, for example, are kind of given a large range. Even when we get them back from the lab will say like, oh, this level looks great.
Totally normal.
Yeah. But then if you want to be a little more intentional, I might say, we might say here at Fiat, like, we actually want, your TSH to actually be lower is more optimal. And maybe, other experts would agree, yeah, it's more optimal when it's lower, but it doesn't need to be that way. And so I've seen that in many cases at Fiat, like, okay, we want the best. We want the best lab value because we're trying to help you conceive, we're going to work hard for that for you. And so sometimes it's like, let's get those lab values not just within okay ranges, but let's really work to get the best lab values we can get. So I think that can relate to thyroid hormones. And then I think too, like we test for hormones that many places just maybe don't even know to test for. Think about prolactin and how that's something we can test for pretty easily. And there's a pretty easy supplement you can take to help reduce your prolactin. And that it just feels pretty simple. Just we'll test for it. Okay, if you have a high prolactin, often there's a pretty simple solution. And
it can affect your fertility.
It can really make a difference.
Right.
Yeah.
Right.
So
and it's like, but this isn't taught at normal, regular midwifery school.
Unfortunately not. Yeah. And even as a midwife, right? Like something that drew me to that program was already this draw towards more holistic health. And I think we had like one lecture on herbal supplements, but yeah, it wasn't enough.
Right. And I think one other thing that comes to mind that we do here that not a lot of places do is we request charts. So like we educate patients or we send you somewhere to educate for cycle charting. And then we look those over. As well as like a Mira fertility monitor or things like that. So maybe tell us just a little bit about that process, and we'll wrap things up.
Yeah. I think this goes back to how the providers here at Fiat, we care about gathering the right data and a lot of data, honestly.
Right.
Yeah, which can be helpful, right? To get a history of, hey, what have your cycles looked like? How have you been charting them? And if you haven't learned how to chart, we have some recommendations of places you can go, people you can talk to, or even devices you can use these days to help you accurately chart your cycle and what's going on. And so I think it just gives us more information to then be more precise, to then say, okay, you should take progesterone starting peak +3. So first, let's learn how to identify your peak day.
Right.
Yeah. And then, okay, we can give you progesterone at the right time. That maybe that'll help your PMS symptoms. Maybe that'll just help you support a pregnancy, things like that. So I think it's more thorough.
Yeah.
And hopefully just helps get a bigger picture, but a more accurate picture of what is going on in someone's health.
Absolutely.
So hopefully help provide the best care.
Right.
That's what we're trying to do.
Right. Yeah. I mean, it's fascinating to me how many women walk in here and you're like, okay, peak +3 labs or whatever. It's a language we use. It's its own language, really. And, I mean, we've had people who come to get their labs drawn and Jenna always makes sure they're on the right cycle day. And then it comes out, they don't actually know how to count the cycle days, which again, I get it. Like, especially if you've kind of lived your life and not needed to know. But when you're starting to get into the nitty gritty of cycles and women's health, like what a valuable piece of information it is to know exactly what your hormones are doing, whether it's based on cervical mucus or basal body temperature or lab work or a Mira. Like all of that is just, again, like you said, like so much data that we can use, but you have to know how to use it.
Yeah. And I see so many women feel so empowered when they learn that about their body, right? Whether it's to identify a problem or whether it's just to learn about their normal healthy cycle. It's so empowering to understand what's going on in your body.
Right. And be like, this is why I'm really pissed off right now.
Yeah, this is why I feel this way. This is why I'm craving chocolate, right?
Yes. Like it all makes sense.
Yeah. Yeah.
I'm not going crazy.
Yes. Yes.
Oh, that's awesome. Well, it's been a real pleasure chatting with you, Emily.
Thanks, Caroline.
I am super excited to have you on our team, and feel free to give us a call if anyone wants to join our women's health team and get evaluated. It's really a special place, which I mean, I can say as someone who's not on the women's health team that like it's been an incredible blessing to see the women's health team grow. Mm-hmm. And the demand for it to me is just a beautiful sign that like women are seeking that care that we give, as they should be. It is far superior often to what you're going to get other places. And again, not saying that in a bragging way, like a really honest way to see women's lives change through this. So anyways, grateful you're here.
Thank you. I'm so grateful to be a part of the team.
Awesome. Well, we'll see you next time, everybody.
Bye.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.